Roy Lilley is a former NHS Trust chairman and joins us. Morning to you, Roy.
Good morning, Julia.
Thank you for joining us. Lots to talk to you about. First of all, what do you make of Wes Streeting, the Health Secretary, ordering a big review by some top experts over the next months to get the results back in the by next summer? Basically, are we overdiagnosing things like ADHD, autism, anxiety, and what can we do about it? Are you hopeful that that might actually lead to some more sense in the system?
Yes, I'm going to say something now that I don't think you ever thought you'd hear me say, and that is, I agree with Wes. I think he's doing the right thing. I mean, I had a quick look before I came on at the international numbers, and the diagnosis in the UK is about 1.3% of people have a formal diagnosis. In the United States, it's pushing 10%. Canada is 7.5%, and Sweden is 3%.
Yeah.
I think my impression here is that we don't really know what's going on, and that's why Sir Simon Wesley, former president of the Royal College of Psychiatry, a very sound guy. In my view, I've sort of known him for a few years. I think they will get to the bottom of it. Some of it is about in poorer areas. It's interesting, in poor areas, in higher social deprivation, the numbers aren't as high as you would expect them to be, and that's because the NHS coverage, the number of GPs per head of population, is lower in those areas. Yeah. So there is a risk that the diagnosis is less. In a more affluent, nicer areas to live, Leafy, Surrey, things like that, the diagnosis is higher. You could say, well, that's because of the families pushing. Yep. Or you could say, well, actually, no, there are more GPs per head of population and they're likely to get a better diagnosis earlier. And if you look at the international data, there is a real link that data is poorer and services are thinner in low-income countries because the services are poorer. So I think looking at it from the outside, I would expect the report to make a correlation between access to diagnosis.
Okay, there's access to diagnosis, but again, we are still diagnosing off the scale compared to a lot of other countries at the moment.
No.
So we are after 20. We've had a massive increase since 2019 of people being diagnosed with some very mild mental health problems, and a lot of people say, well, there was lockdown, but that hasn't happened in other countries where there has been lockdown.
There is a pattern right across the OECD countries of an increase in these kind of diagnoses, and the numbers are up. But again, there's very poor data. I mean, NHS services, certainly in the NHS and probably more widely, have always been the Cinderella services, really. A new hip, bouncing baby is what the NHS is all about, but someone with deep depression and schizophrenia really hard to manage. That's not the attractive.
But here's the thing, as we know, because severe mental health problems are a really big serious issue and need to be treated seriously, and they need all the help, and they can often be very expensive. But we can't channel resources into that if half the class or half a cohort of young people have got supposedly a mental health problem. We've got kids who've been diagnosed like, I've got anxiety, I can't leave the house, I can't work. We've got kids being diagnosed with ADHD, some of whom, frankly, are playing a Game Boy up till Xbox till 3 in the morning and being given a Lucozade bottle for breakfast. It's not a mystery. And then you've got the kids who are genuinely on the spectrum, genuinely need help, and children and youngsters who've got genuine health problems, mental health problems. Then they're getting missed by the system because of all the other people around them whose parents are either gaming the system to get benefits or to get their kids extra time in exams, or who frankly are just medicalising normal human differences and normal human emotions.
Which is why I agree with Wes. We need to get to the bottom of this.
Yeah. Well, hopefully. The question is, if they get to the bottom of it, will they do anything about it?
Well, I think if it looks like it's going to cut benefits, they will. If it looks like it's going to put the cost of treatment up in the NHS, they won't.
Yeah, there is that. Well, again, I don't believe for a moment they're actually going to act on it because Labour backbenchers won't let them. Let's talk about what's going on in A&E right now. And anyone who's had to go to A&E will know that, even on a sort of a Thursday morning, it's often absolutely packed. But A&E departments are under siege, health officials have said, by patients with, nonsense claims like hiccups, ingrown toenails, blocked noses. More than 200,000 100,000 A&E cases last winter could have been dealt with elsewhere. Almost 100,000 people with just things like sore throats. And yet, currently under siege with a number of flu patients. It's up more than 50% on last year, with 1,717 patients in beds in England each day last week, including 69 in critical care. We are approaching, the full-on winter crisis, which follows on from the autumn crisis and the summer crisis and the spring crisis and last year's winter crisis. But we do still have this issue of people turning up to A&E who don't need to be there, partly because they can't get to see a GP, or the GPs, won't give them their appointment within 2 weeks' time. But partly also because they know they have to be seen. Do we need to stop the situation where doctors have to see someone in A&E so they can be triaged and be told, no, go home, you're wasting people's time?
Well, they do that. I mean, these trivial things that we're talking about this morning, I mean, they make good copy in the newspapers, and yes, it does happen. But, the A&Es are staffed by very sensible, experienced people, and they're not stupid. And somebody comes in with an ingrowing toenail, or in the case of the hiccups, they just burst a paper bag behind their back and give them a shock and send them home without the hiccups. They're pretty good at sorting the wheat from the chaff. It's annoying, but they sort it out. So that's not a big issue. What is a worrying issue is what is happening to the flu. Yeah. If you want to know what's going to happen with the flu, you have to look to Australia, because generally speaking, we follow what's happened with them. They've had a very early flu season, and it's been horrendous. And they've had, pictures of people in corridors and all the kind of problems that we've had here. So yes, there is a problem with the flu. If you can get a flu jab, get it. If you've got to pay for it, it's worth it, because this is a very nasty strain of flu, and it is causing lots of what we call exacerbations. That means making existing conditions worse. And that generally means older people. That generally means a couple of nights in hospital. And that generally means getting them out and getting their care package reinstated is a palaver. So yes, it's a problem.
It's a big one. I think we know flu, like COVID, affects elderly people, but unlike COVID, actually, you can also affect younger children as well.
Absolutely.
And that can be a particular issue.
And we got 14,000 people in hospital with COVID now. Yeah. So, COVID hasn't gone away. And for some people, it can be...
Are they being treated for COVID, or are they just being randomly tested for COVID?
No, they've been treated and they've been admitted with, with a lot of breathing difficulties.
For COVID.
The key number of people, the key people that we're not jabbing, and I think everybody should have a flu jab, to be honest.
I've never had a flu jab. Never even occurred to me to get a flu jab.
Yeah,
I mean, that said, I was largely very healthy until 2020.
Yeah, well, there you go. But I mean, I'd make it easy for employers to buy the flu jabs and do it for their staff and stuff like that. The issue here is there's a particular group. It's a sort of the dads between 30 and up to about 55. They don't get a jab quite often, and they are big spreaders. They pick it up at work, or the kids give it to them, and then they give it to their older parents and all the rest of it. There's that cohort that I always think that public health overlook, and I think they are.
And does the flu jab stop you from passing it on? Because remember, we were told that COVID, if you had the COVID jab, that's the reason I had one of the main reasons I had it was although I'd already had COVID, I wasn't worried about COVID myself, but it would stop me from being able to catch it and pass it on to an elderly relative. That wasn't the case, but
it's not a magic solution. But what it does mean is if you do pick up the flu, you'll be less ill, and there'll be less chances of you passing on something that's really horrible and will do a lot of damage. I think it just makes a lot of sense. I'm of the age now where they give me a free everything, so I'm the walking dartboard. They come in, they say 180s just walk through the door, so I get all the jabs.
Well, maybe I'm on my way. Maybe I should start doing that. I don't know. But again, we do have the NHS. It always moans and freaks out about every winter. Is it particularly worse? Because we were warned, weren't we, that the suppression of flu by COVID, because the COVID bug was so virus was so strong, and it basically suppressed a lot of the other diseases. And then, of course, COVID is still with us, but the other ones, they've come back. We were told, I remember 2021, look, when flu comes back, it's going to come back with a vengeance, and it has.
It has. It certainly has. And the difficulty is, as I say, it exacerbates other conditions. Yeah. And that particularly in the elderly, and that's what sort of gets a lot of people who are are in medical beds. When the medical beds are full, you start on the surgical beds, and then when you go on the surgical beds, you have to cancel elective procedures because you haven't got any beds for people. And we've got the strike coming up as well. Don't ask me about the strike.
Go on, I want to ask you about the strike very quickly. I mean, the timing is not helpful running up to Christmas.
No, it isn't. They know exactly what they're doing. They're not. I don't think they are carrying public support. They know what they're doing. They're striking at the employer at the worst possible time. The difficulty is this, Julia, that the contract is held between the Department of Health and the doctors. The NHS has really got nothing to do with this other than sort it all out.
It's up to Wes Streeting, basically, at the end of the day.
Down to him, and he's got to swallow his pride and sit down and talk to them.
Well, I believe they had talked quite a lot, but, there we are. Anyway, just give them more money and they'll just keep coming back for more. Roy Lilley, always a good talk. She covered a lot of ground there, former NHS Trust Chairman. Thank you very much for that. Philip Ingram, I mean, no offence. You're of a certain age as well, not much older than me. Do you get all your jabs? Do you get your flu jab and everything? I mean, if you're elderly, you're supposed to definitely. I don't know.
I've had flu jab a few times. When I went going through cancer treatment, I was in the vulnerable stage.
Yeah.
So yes, I went and got all my jabs and bits and pieces. But
we were warned. All these disease just didn't go away, and all these people who've lost. The thing is, there is an element where people have lost a lot of their immunity because they weren't out and about, don't see as many people. But also flu bugs have exploded again.
The number one threat for a pandemic that will kill more people than has done is a flu pandemic, and we saw in the 1920s. We saw in the 1920s the Spanish flu that came through and killed millions across the world.
Yeah, absolutely, and children, crucially.
Yes,
absolutely. Rather than people at the same. I know, I'm not saying I've got relatives in their 80s. Not expendable, but I think we're more worried about kids dying than 80-year-olds. I'm sorry, we are. And if you're not, then there's something wrong with you.
Children, 20-year-olds, 30-year-olds.
Yeah, exactly. 11:48.